Anemia. Prevention, causes, treatments, and hidden clues. Anemia is a blood condition in which there are too few red blood cells, or the red blood cells are deficient in hemoglobin. Red blood cells deliver oxygen to the tissues and organs of the body. Hemoglobin is important because it is the iron-rich protein in red blood cells, which carries oxygen to the body. Anemia can often go undetected until it is highly progressed and symptoms are more ominous. Anemia can be caused by any number of things: iron deficiency, vitamin B12/folate deficiency, excessive blood loss, medication-specific chronic or hereditary conditions. The most common symptoms of anemia are weakness and fatigue. Some other signs and symptoms of anemia would include shortness of breath, dizziness/lightheadedness, palpitations/heart racing, headache, coldness in the hands and feet, pale skin/pale inside of lower eyelid, change in stool color, including black and tarry stools, visibly bloody stools. In simple words, these signs and symptoms can occur because a low red blood cell count decreases oxygen delivery to every tissue in the body. There may not be any symptoms until the anemia becomes more severe. There are many reasons oxygen deliverability may be decreased. Oxygen delivery affects how the mitochondria function. Mitochondria are the primary energy producers in the body. Their performance affects the functioning of all other muscles, organs, glands, and even the brain. Mitochondria need both oxygen and glucose to function optimally. An imbalance of either of these will cause inadequate fuel for the body's processes, which affects tolerance to exercise, the ability to lose weight, and overall health. One potential complications of untreated anemia are arrhythmias. 2. Organ damage. 3. Reduced blood volume that can lead to loss of life. The first goal of treatment is to find the underlying cause, then to increase the oxygen carrying capacity of the blood. The main causative factors of anemia are blood loss, inability to produce an adequate number of healthy red blood cells, high rates of red blood cell destruction, lack of dietary iron. Treatments may include dietary changes or supplements, medicines, procedures, blood transfusion, or surgery to correct internal bleeding. Medications and treatments include supplements such as iron, antibiotics to treat infections, hormones to treat heavy menstrual bleeding, erythropoietin to stimulate the body to make more red blood cells, medicines to prevent the body's immune system from destroying its own red blood cells, and chelation. Be advised that medications affecting stomach acid, such as antacids, antihistamines, and proton pump inhibitors can interfere with iron absorption. Be sure to discuss any prescription or over-the-counter medications you are taking with your healthcare provider to avoid any possible interactions. As with all things, prevention is better than treatment, and prevention starts with awareness. To prevent anemia, you must have enough red blood cells in your body to efficiently carry oxygen. A proper diet filled with iron-rich, nutritious foods, healthy sleep patterns and exercise can help to keep your body producing adequate amounts of red blood cells.